safe. When nurses aren't safe, the patients aren't safe. When nurses aren't safe, the patients aren't safe.
I'm Lauren, and I'm a transplant nurse here at UC, and my concern with this whole pandemic with COVID-19 is that my patients are immunosuppressed, and so my concern is like having these patients come onto our floor, and with what UC is telling us that our ratios are 3-to-1, or it's based off of the patient's acuity, and these nurses, or the nurses on my floor, like, not only are we then assigned to these patients who are suspected to have this virus, then we potentially can be exposing our immunosuppressed patients who are recently transplanted and putting them at risk as well. So my concern is to protect not only my nurses on the floor, but also to protect my patients who are immunosuppressed, and making sure that we're not exposing them, because they are a vulnerable population in themselves. So that's why I'm here.
And do you think the hospital prepared? I mean, it was announced this morning by the World Health Organization that there's a world pandemic. What does that mean? We've never had one since 1919, and there's a lot of concern that the healthcare workers and the healthcare people who are responsible for the healthcare people are not really being prepared.
I mean, I have my finger on the pulse on my floor, and a lot of my nurses are concerned, as well as myself, that UC isn't providing the correct amount of education and training and resources to protect us and our patients. Like, even yesterday, I had a nurse come up to me and say, I wasn't even trained on how to even review on going over protective PPE and everything like that. Even though, yes, they do provide us with the modules and education and stuff, but it's with all of this heightened anxiety and pressure, and these new admission of all these patients coming onto our floor, people feel there needs to be an increased amount of education and training, and I don't feel like UC is doing that.
And there also is an issue of staffing. It looks like there's going to be a much greater number of people going to hospitals. Do you feel that you're staffed up in preparation for what may be hordes of people, thousands of people?
I mean, I don't think so. I mean, from what the union is telling us, I feel like the ratio for taking care of these patients should be 1-to-1, and now already with them telling us our ratio is 3-to-1, we definitely aren't staffed well enough.
And this is going to lead to a lot of stressed out staff. I mean, there are concerns in China and Korea of the healthcare workers themselves becoming infected. Are you and others concerned about that?
Absolutely. There was that one nurse from Kaiser who had made her statement known about how she had taken care of a positive COVID patient, and she then herself started showing symptoms, and they weren't allowing to test her. They wouldn't test her, and that is my concern too as well for my nurses, is that if somebody is taking care of a patient and then they themselves get exposed, and then they start to show symptoms, God forbid something were to happen to one of us, that's scary.
And what is the testing protocol here? Are they prepared for testing, particularly the workers, so they don't get contaminated?
That's a great question. Honestly, I don't know, and that's a great question to ask UC, and I feel like that they need to address that, and because all the nurses want to know.
And as far as safeguards, there's a concern that the government is downplaying or downgrading the protection for healthcare workers. Are you concerned about that? Any downgraded protections?
I'm sorry, repeat.
They're downgrading protection for healthcare workers for COVID-19.
No, if anything, we're the front line. They should be providing the utmost amount of protection for us as much as possible. It shouldn't just be based off of what the CDC is doing. I feel like the CDC, yes, they're doing as much as they can to educate everybody, but I feel like they're behind the ball on it, and they need to make sure that the nurses and the frontline staff are being protected as much as possible, because we're the ones who are taking care of these patients.
Communication has been not great. They've said basically to us very dismissively, this is not Ebola. And they've said, you've been trained in hand hygiene, you've been trained in isolation methods. Yes, we have. But this is a heightened situation. This is a situation where, in our day-to-day work, sometimes we don't do procedures for a few months. We need refreshing training. And they've been dismissive. They've left us out of the conversation. And we're here to do a good job. We do that every day. So we want to be part of the team, and we need to be a voice in that care.
So it sounds like is the main thing you want to come of these actions more communication, or can you talk about a little bit of the specifics of what you want to happen next?
Absolutely, clear communication, and then ongoing training. Hospitals, because they are so profit-driven, they're doing just-in-time training. So when the first patients got here, they did just-in-time training.
What does that mean?
It means right in the moment. Guess what? Your patient's right there. This is how you do it properly. So again, we have been trained in that, but it's a heightened situation. It may be something you don't do every day. You need to be watched to make sure that when you remove the equipment, you're not contaminating yourself.
And this should be the last question for me, but can you tell me more?
I think you have 3 points, right? You have communication.
Oh, sorry. So the training, and then again, the proper protective equipment. We've heard various things from nurses. Again, staffing has been, they have more patients now. Sometimes they can't get the equipment right away. There hasn't been communication about how to escalate it because they have done conservation methods, but they haven't communicated how we escalate when we need that equipment. Some critical areas that should have it every day because of the conservation methods don't have it, and they should still have it. So again, it's communication, training, and supplies.
And could you tell me more about yourself, your job here, how long you've worked here? Yeah.
So I've been a registered nurse here for 31 years. I take care of adults after surgery. And unfortunately, I'm pretty upset about this. Again, we've been through this with H1N1. We've been through this with Ebola. We have the highest aerosol transmission standards in the country because of our union. And so we're expecting UC to follow that. Why are we doing this again? Why are we here again? I told Dr. Byington at the Office of the President, last time with Ebola, they said they had planned for 2 months. Nurses were never part of that conversation. This time they said for 2 weeks they planned, and educated staff. Nurses were not part of that conversation. So you're leaving out a critical piece. We're the first ones that see the patient. We're the one that spend the most time with the patient. We want to do a good job. Don't set us up to fail.
CDC has you charging has downgraded your protective. Why don't you talk specifically about what that means?
Wait, I'm sorry. Can you first explain why it matters that the whole chant about patients and patients need to be protected because the community. Explain what that means. And then.
Well, obviously the nurses need to be protected to do their job well. And if we can protect ourselves, we're going to do the best job for our patients. We're going to make sure they get the best care. There's no lapses in care. There's no missing of care. There's no contamination. And if we can, obviously in a situation that we're in now, if we can stop this, then our community will be safer. Clearly, this is rapidly developing and more people are becoming infected.
So the CDC, as you are charging, has downgraded protective measures for healthcare workers. Why don't you talk specifically about what that means?
We feel that we're at risk. There is still some unknown information about this virus. Again, we're concerned about transmission when people don't show any symptoms. This is a time, and again, it's spreading. We're seeing community spreading. And we need to have the utmost protection to stop it. It's not a time to dial down protections.
And this is a premier institution in the world, UC San Francisco Medical Center. What does it say when you report here that you have to reuse masks? I mean, Governor Newsom, what do the regions think about this? I mean, the fact that
I think there's 2 things about that. It's a symptom of our broken healthcare system, right? And our economy. Some of that. There's a lot of pieces to, right? But. UCSF has told us proudly that they have the largest supply of PAPRs in the UC system. So hopefully that'll help us, but we need
ever had to reuse masks in the past?
The N95s, yes. They say some of them you can use up to 8 hours. So yeah, but in a critical situation like this, we all agree that we would not reuse a mask if it's a known positive patient.
And other healthcare workers in Korea, Japan, and China have themselves been infected because they haven't been properly trained. What you're saying is that there's a possibility of that happening. It may have happened at Kaiser as well in Roseville?
We don't want to see that happen. Nurses believe in anticipating the needs of patients. We believe in prevention. We do not want to see that happen. So that's why we're saying there's no need to dial down protections. we want to make sure that no more.
My name's Ashley Burnin, and I'm I'm the nurse representative for Float Pool. And my major concern is staffing. Our hospital originally sent out staffing guidance ratios that said 1-to-1 for any patient, one nurse to one patient for any patient that was suspected or confirmed COVID. And since that has happened, they have not been upholding those staffing ratios. They say that we just don't have enough staff, which is not true. Several years ago when Mission Bay opened, UC was offering incentive bonuses for nurses to come in extra, encouraging them to work when there was a higher demand, and we need that now. Overtime shifts are being denied. Per diem nurses who had previously been working full-time have not been getting their approved hours. They're still making more than their minimum, but not what they are willing to work. And so my biggest concern is that, and also, we can't necessarily control the amount of supplies that we have, but something that UC can do is provide more staffing for us so that we can more focus on those patients and have one-to-one care so that we don't spread any infectious disease to other patients around the hospital, and those nurses have dedicated priority for those patients.
Are you concerned that you have to reuse masks?
Yes, that is of course a concern. There is a national mask shortage, so to some extent we just have to do the best that we can. We definitely don't want to be reusing masks for patients who are confirmed with the virus or other infectious diseases such as influenza or other things. But while there's rule out and while we have limited supplies, we have to do the best that we can. And we hope that UC is working hard to acquire more protective equipment for nursing staff.
And the World Health Organization said it's now a world pandemic. We haven't had one in our lifetime since 1919. It may mean thousands and thousands of people coming to this institution to try to protect themselves. What you're saying is that not enough is being done to really prepare for what may be coming.
Right. I think UC is doing the best that they can at this point, but ultimately we are very unprepared for a large pandemic, and it is the nursing staff and the physician staff that are the frontline workers, and we are doing the best that we can, and all we can do is raise our concerns and advocate for ourselves and our patients.
You know anyone that's been tested here for COVID-19?
There have been a few exposures. There have been several healthcare workers that have been exposed and tested.
And they've been negative, hopefully.
That I don't know. I don't know the follow-up. Hopefully, yes, hopefully.
Okay, thank you. What's your name?
Thank you. Ashley Burnin.
Thank you.
Thank you.
You're saying you're reusing masks?
We are reusing masks, yes.
Has that ever happened before?
This is new. The supply of equipment is limited. We get supplies from China, so there's a limit there as well. And now we're just mitigating risk is what we're trying to do.
Well, there have been cases of healthcare workers around the world being contaminated in China and Korea and other countries, and Japan. Why hasn't this country gotten in gear to really protect the healthcare workers who are the first line of defense for people who are concerned about their health?
That's exactly why we're out here. We're asking UC, why haven't we prepared for this? We've done more work for what's the word I'm trying to think of? Sorry, pardon me. We've done more work for disaster preparedness in the last 2 weeks than we have in the last 2 years for UC. So there's still a ways to go. It's still a learning process for all of us. And it's something that we should have been addressing earlier. We should have a system in place We've started making step by step, but you can only do so much.
Now, the World Health Organization this morning announced that this is a world pandemic. And what you said earlier is that you're understaffed now in this hospital, that you can't really keep up even now without thousands of people coming to the hospital. What is the future? I mean, it seems like it's an emergency situation. It seems like you have to have massive staffing increase to prepare for what's coming.
I've been asking for staffing increase for a while now with the emergency room so that we could get adequate staffing. It's something that I've met with management about as a union rep many times, and we're still in the process of doing that. This is going to add to that, and what management is going to do about that is questionable. We're still figuring that out.
Well, Governor Newsom, the UC regents who run the UC hospitals, what have they done? What have they said to prepare, that they're going to do to prepare the UC hospital system for protection of the patients and the public and the workers at the system?
You'd have to ask them that.
You haven't gotten any directives from them?
There's a huge lack of communication, and to get email after email is not something that you can keep up with. When we have processes changing several times a day within our department, it's hard to keep up.
And as far as patients at UC, people who are going to come to UCSF, do they have reason to be concerned about whether or not they'll be able to be taken care of because of the lack of staffing and the lack of communication?
We are doing the best that we can, and as nurses, we will go that extra mile, and that's why you see nurses getting sick, because we will do what we need to do to make sure that patients get taken care of. But the lack of staffing and the lack of planning has put us in this point where now everybody's scrambling, and that's what we're trying to solve.
And UC, although it's a public institution, is making a lot of profit, the hospital end of it. What do you think about the whole healthcare system in this country at this point? Is it prepared for what is a national emergency?
I think I'm going to bypass that question. It's a big question to ask for today.
What should people do who are concerned about UCSF and other medical institutions being prepared for this upcoming epidemic? What should they do?
I think as a patient, if it is an emergency, then come to the emergency room. If you are sick, then it's okay to be sick at home. If you are dehydrated and you think that you need to come to the emergency room because of that, come to the emergency room. If you're having trouble breathing, come to the emergency room. But if you can talk to your doctor, your family doctor, your primary care doctor, and deal with it from home, then that's okay too. We are not testing everybody that's coming in.
Have there been any tests of COVID-19 here at the hospital?
We are capable of testing now, but that is limited as well.
Have there been any tests, sir?
Pardon me?
Have there been any tests of COVID-19 at this hospital that you know about?
That have been positive? I'm not sure of the testing results offhand.
You don't know how many tests? They're not talking right now.
Yeah.
One of the issues.
They're not talking to us either. So
basically, they're not talking to the press and they're not talking to the workers. That raises the question: who are they talking to?
That's internally. They're talking internally, and so the lack of communication is evident through that.
Okay, thank you.
So my name's Maureen Dugan. I'm a registered nurse here at UCSF, and I'm one of the nurse representatives for the California Nurses Association. So we're here today. UCSF nurses continue to express concern regarding how management is communicating with nurses and other frontline staff about the handling of COVID-19 at UCSF. Our first priority is to ensure that staff are safe, informed, and prepared to provide care to our patients during this period. While we recognize the efforts of UCSF management, there continues to be a real lack of information and transparency between the administration and the frontline caregivers. Nurses want to be able to do our jobs, but we need to be part of the planning, have ongoing training and equipment to do it safely in the face of infectious diseases. We have been here before, unfortunately, H1N1 and Ebola. Each time our union is forced to address the same issues with UC. How do you continually leave direct care nurses out of the planning and communication with each outbreak? So next, I'm going to introduce Bridget Parr, who's a nurse in our emergency department.
Hi, I'm Bridget. I work here in Parnassus emergency room here at UCSF. We are the first line of defense when patients enter the hospital. Even prior to the COVID-19 outbreak, we have been incredibly busy and short-staffed, holding admitted patients in the emergency room for extra hours, oftentimes for days. The hospital is running at 98% capacity right now, which means there's simply no beds available. When the census is this high, we often have more patients per nurse than the state mandated number allows. We are out of ratios. UC has put up some tents outside of our department, making it clear to us that these tents are not meant to address the issue of overcrowding. The tents are meant to treat patients with respiratory complaints that could potentially go home rather than being admitted to the hospital. We are operating in a system that is overburdened. Overburdened to the point that we run the very real risk of running out of PPE, personal protective equipment. Staff are being told to reuse our masks unless it is a high-risk patient that is being tested for COVID-19. If we don't reuse these masks, we will run out of supplies. When a person walks into the emergency room, their diagnosis is uncertain. We don't know if they are going to be tested for a virus or not. We are being told as long as our masks are clean, they can be reused. It may be many hours before they decide to test the patient for the virus, and testing is limited. Sick staff may not even be tested. We are wearing masks and goggles to decrease our risk, but it is not enough. The risk is still not 100% eliminated. The system is so overburdened that staff are not immediately informed that they have been in contact with a positive COVID patient. And if we are informed, there is nothing said about quarantining. The only information we are given is that we should self-monitor and not come to work if we are sick, if we are showing symptoms. We want to be protected so that we can care for our patients. We need to stay healthy, and we need adequate staffing and protective equipment to do our jobs and to protect the public. If frontline nurses get sick, who will care for the patients? Then what?
Thanks, Bridget. Now we're going to hear from Jam, who's on the medicine unit.
Hi, my name is Jamil, and I work at UCSF on the medical surgical unit. I'm also the professional practice committee chair, where we advocate for nurses and patient safety. We insist that UC follows a precautionary principle, meaning we do not wait until we know for sure that something is harmful before we take action to protect people's health. We are outraged that the CDC has further weakened its guidance on PPE and not requiring suspected or confirmed COVID-19 patients to be placed in negative pressure rooms at all times. These changes will endanger nurses, healthcare workers, patients, and our communities. We call on UC to follow the Cal-OSHA aerosol transmissible diseases standard and place all suspected and confirmed COVID-19 patients in negative pressure rooms. If nurses are not safe, the patients are not safe. Again, if nurses aren't safe,
The patients aren't safe.
If nurses aren't safe,
The patients aren't safe.
if nurses aren't safe,
The patients aren't safe.
All right, so to conclude, we have told UCSF and Dr. Byington at the UC Office of the President that we have a shared interest in getting this right. Nurses will continue to work with UC to ensure we have clear and ongoing communication, ongoing training, and proper PPE. Nurses show up every day and every night to care for our patients to the best of our ability. We want to be supported in that effort.
We didn't want nurses who had young kids or who had elderly patients to work with those patients just for their safety.
There's a lot of layers.
And me, I mean, as someone who's I'm living on my own, I thought it was a safe bet to just work with those patients. But also, I'm the professional practice committee chair for UCSF and the Nurses Union, and so it's my responsibility to make sure that nurses are safe, so that way, and that patients are safe, that we're working together with the university in creating better standards for everyone.
Yeah, and I wanted to ask you also about the lower guidelines that have been put out and what your reaction to that is.
It's kind of a shock. I know the World Health Organization even put out to just wear a facial mask and goggles, so no more N95s, which would help take out the particles that could potentially infect someone. And I know Seattle, they're following that precaution, and I'm sure the healthcare workers are in upheaval about that because there's no guarantee for safety until something happens. And again, that's the precautionary principle. We don't want to wait until a nurse, until a healthcare worker, until anybody gets infected. So why are we not implementing the highest standards?
Yeah, and I'm curious, after having volunteered to do this, and after being given inadequate training, did that make you think twice about whether it was a good idea?
It definitely did. I mean, I was wearing gowns and I had my neck exposed, and you see in the media there's other healthcare workers who are fully covered. So yeah, I just made sure that I was really practicing hand hygiene well, that I was just not touching anything else in the patient's room. So yeah, it gave me a little more anxiety and just kind of more pressure to make sure that I was doing things safely so that I wasn't contaminating myself and contaminating, my colleagues and the community around me.
Yeah, and so you said that there are confirmed cases here at the medical center?
I'm sorry, what was the
there's
question?
confirmed cases.
Yeah.
No, we're not going to speak to that.
Okay, no, I just thought that's what you said, so I misunderstood.
Or in the past.
What was the question?
Oh, if there have been confirmed cases at the medical center.
In the past,
yes.
there were reports in the press about it. So we can't confirm any cases right
Oh,
now.
okay.
Are you concerned that the university management here is not available for press? They won't even talk to the press about what's happening. They won't talk to you apparently, but also they're saying they're not going to be available for press.
I'm not sure on their end. I'm not sure on their end.
How long have you worked here?
5 years.
Have you ever had to use masks more than once? I mean, use masks?
Honestly, I personally haven't. On our unit, we were always stocked and we had them ready available, but it seems that this global shortage and this pandemic in general is just making everybody roll back on guidelines.
And there's a kind of scramble. People are buying masks and threatening selling them online. And that's
It's insanity. It's unfortunate that the community is all scared, and it's kind of precipitating, the media is kind of precipitating this ongoing fear about it, and it's making everyone in fear. But for the people who really need those equipment, the healthcare providers, they need to be well equipped so that this infection doesn't spread elsewhere.
And there is no mass outpouring of people now coming to this institution. But if there's a breakout in San Francisco, there may be thousands of people coming here. What you're saying is that this institution is really not prepared as it should be to handle the possible, there may be thousands of people coming here because they're fearful if there's a breakout in San Francisco.
We can't speak about the future.
Not sure.
But you feel you're understaffed now, and there needs to be much more staffing.
There definitely needs to be more staffing, more PPE, more communication. It's still all evolving, but there's still all this room for improvement.
What's your name?
Jamil Kabakungan.
Thank you.
Thanks. I think the world saw this coming, or maybe they did, but they didn't think it would happen now, and now we're all scrambling to get things done to make sure that this infection doesn't end the world. So it's scary, and we just got to work through it together, and we just hope that we're all protected.
And the National Nurses Union has called this National Day of Press Conferences. That's important for informing the public about some of the issues of healthcare workers. You think that the rest of the healthcare union should start getting involved and uniting to deal with this issue? It's not just nurses, it's other healthcare workers.
Well, yeah, that's true. I mean, there's nurses who are in this, but then there's doctors, there's respiratory therapists, there's the housekeeping, the hospitality staff who go in the room. So, yeah, I mean, if everybody has to get on board about protecting themselves when they work with these patients. So, yeah, it shouldn't all just be the nurses union. Everybody needs to start getting together to advocate for everyone's safety.
Thank you.
My name's Maureen Dugan, a registered nurse here at UCSF.
And you're going to be having a press conference here today around issues of concern as far as the health and safety and protection of the nurses and the patients. What are your concerns?
Well, we want to be sure that we are fully informed of the plan. We have told UCSF that we need better communication and we need ongoing, consistent training, and we want to make sure that we have the proper PPE. We also are disagreeing with the CDC's relaxation of guidelines. We feel like this is the time to have maximum protections and precautions, not to be dialing it down.
And what have they done to raise concerns about that you don't have the proper protection?
Communication from the start has been very poor. It's been very delayed. We're now 5 weeks into taking care of patients, and things are just starting to be developed. And so, we would have wanted them to have that conversation, but when they were planning, when we actually requested information in January and received no reply from them, and then we only got information from them after the patients were here. So we're going to work with them, but we need what we need to protect the nurses and to protect our patients, and we're not going to accept anything less. And
the World Health Organization this morning said that this is a world pandemic now. What does a pandemic mean? We haven't had one since the Spanish flu in 1919. What does it mean for nurses, for healthcare workers?
I think that our concern is that we're unprepared. Hospitals are unprepared.
How are you unprepared?
Well, we're unprepared. We don't have these plans in place. There's an opinion out there that maybe we've been planning for earthquakes but not pandemics. Obviously, we all know there's supply chain issues, but again, hospitals, we have a broken healthcare system. They are maximizing profit. That's the main focus from the administrators anyways. And we don't work as a team. We're all trying to grab our corner of the market, and so we as a United States healthcare system are not prepared for a pandemic.
So they're saying there's a lack of communication here with UC management. Why haven't they been, they're charging that you haven't been communicating with them. Is that the case?
Nurses aren't safe.